Well, the WHO has declared Nigeria Ebola-free, crediting its rapid response with halting the spread of the disease in Africa's most populous country. VOA's Jeff Swicord tells us what the Nigerian medical community did to beat a disease that is devastating Guinea, Liberia, and Sierra Leone.
Medical experts from around the world are studying the success of the Nigerian response to see what they can learn. Nancy Knight with the U.S. Centers for Disease Control and Prevention is working with the Nigerian Emergency Operations Center in Lagos.
Nigeria's response in terms of the difference from other countries had to do with the speed at which they began their response by identifying the imported case and the establishment, the utilization of the incident management system with the establishment of an emergency operations center.
On July 20th, a Liberian American en route from Monrovia collapsed inside the international airport in Lagos. 3 days later, Nigeria's first or index case of Ebola was confirmed. Dr. Faisal Schwab is the incident manager at the Nigerian Emergency Operations Center.
So even ahead of the detection of a case, we already had capacity building going on in the states. We already had trainings and pre-position of supplies.
Health experts say the spread of Ebola to Lagos, a densely populated city of 18 million, was a potential catastrophe. Nigerian officials quickly sent out investigators to identify and isolate all contacts with the index case. The list of potential exposures grew to more than 800.
One thing that could easily have led to a worse scenario was if the contacts or if cases were in the communities and spreading the disease. But this was not the case in Nigeria because we were followed up the contacts as aggressively as possible.
Fever is one of the first symptoms of Ebola. Here at Murtala Muhammad International Airport in Lagos, travelers must fill out health forms declaring any contact with Ebola victims and have their temperature taken. Dr. Alex Ako is director of Port Health in Lagos.
Thank you. For passengers who have symptoms suggestive of Ebola or who have a temperature above 38 degrees, they don't get to check in.
Community outreach is another critical part of incident management. These volunteers have visited 26,000 households, educating the public about how the virus is spread. Outreach worker Samson Amateo.
Being African, some people think Ebola is a kind of a curse, and some take Ebola to be a spiritual infection. But we were able to make them know that this thing is real.
Nigerian officials say they will continue screening passengers at ports of entry as long as Ebola is present in neighboring countries, where there is currently no end in sight to the crisis. Jeff Swicord, VOA News, Lagos.